In this video, we are going to rationalize the 20-item questions as part of our final requirement in Mastery in Developmental Psychology.
For item 1, Felix, who is a collectivist person, believes that family and caring for each other is important, while Oliver, who is an individualist person, values self-expression and personal freedom. Where does this fall in Bronfenbrenner's biological theory? A. Macrosystem, B. Mesosystem, C. Microsystem, and D. Exosystem. So the correct answer here is A. Macrosystem, because macrosystem talks about the beliefs, cultures, ideologies, and perspectives of an individual. And when we say collectivist, or being a collectivist, or being an individualist, we can consider it as a perspective or as an ideology. So these factors like beliefs, cultures, ideologies, and perspectives does not only affect a person's surroundings, or does not only is a foundation of his or her society, but also it affects his or her perspectives as well. So basically, a person incorporates the thinking of his society as a part of his or her beliefs, ideologies, or thinking. We can see here the difference of collectivist and individualist, and the difference of cultures, ideologies, and perspectives of a different society. Next, letter B, mesosystem, is incorrect because basically it's a linkage of microsystem, or it's a linkage of interaction of an individual in his or her parents, classmates, peers. Letter C, microsystem, is incorrect because more of this talks about the closest interaction of an individual to his siblings, parents, and classmates, so it's an interaction. Exosystem is also incorrect because it talks about the indirect effect or indirect influence of the community towards that individual. Item 2. When Paquito was young, he had friends who liked playing basketball and are always present when there is liga in their barangay. Paquito is not really interested in basketball, but later became interested and skilled at it because of his friends. What theoretical issue does this focus on? A. Organismic and reactive, B. Organismic and active, C. Mechanistic and reactive, and D. Mechanistic and active. So the correct answer here is C. Mechanistic and reactive. Organismic and reactive is incorrect because organismic is more of from Rousseau, and reactive is from Locke. So organismic model sees people as active, wherein their development is more of internal, or they create their own, or they have their own choices when it comes to their own development, while reactive sees the development as being influenced by experiences. Organismic and active is also incorrect, which is letter B, because while it is both connected to Rousseau, but it is more focused on the belief that people create their own experiences. Letter C is mechanistic and reactive is the correct answer. This is connected to Locke, and this is more focused on the belief that people are shaped by their experiences, or people are influenced by their environment. We can see here in the item that Paquito at first doesn't really like basketball, and more of like he's not interested in basketball, but because of the influence of his peers and as well as his experiences in watching liga or playing basketball, because his friends like basketball, so he had no choice but to play basketball also. He had experienced, or because of the influence of his peers. Mechanistic and active is incorrect because mechanistic is from Locke and active is from Rousseau. So mechanistic model focuses on influence of environment and experiences in the development of a person, while active is more focused on the belief that development is internal, or people chose their own way of development.
Number 3. At her first prenatal checkup, James Obigani emphasizes the importance of taking folic acid, especially during early weeks of pregnancy. This is mainly to prevent A. Intellectual disabilities, B. Limb deformities, C. Heart defects, and D. Neurological defects. So the answer for item 3 is D. Neurological defects, since folic acid or vitamin B9 is vital for neural tube development in the first 3 to 4 weeks of pregnancy. A deficiency at this critical time can result in anencephaly or spina bifida, which are both serious neurological defects. Option A is incorrect because intellectual disabilities are multifactorial. So they result from various genetic and environmental conditions, not just vitamin deficiencies. Option B is also incorrect limb deformities are often linked to genetic mutations or environmental exposures like certain drugs, and not directly due to folic acid deficiency. Option C is also incorrect. While heart defects can occur during early development, they are more often associated with chromosomal abnormalities or teratogens. Number 4. During an ultrasound, a doctor informs the parents that their twins share the same placenta but have two separate amniotic sacs. What kind of twins are they most likely to be? A. Dizygotic, formed from two separate fertilized eggs. B. Monozygotic, split during the blastocyst stage. C. Monozygotic, split after the second week of gestation. And D. Dizygotic, implanted closely and sharing one placenta. So the correct answer for item 4 is B. Monozygotic twins that split during the blastocyst stage, and this occurs around 4 to 8 days, and the twins usually develop with a shared placenta and two amniotic sacs. This is the most common type of identical twinning. For option A, it is incorrect because dizygotic twins develop from two separate fertilized eggs and always have their own placenta and amniotic sacs. For option C, it is also incorrect because splitting after day 13 of gestation is rare and usually leads to conjoined twins due to incomplete separation. Option D is also incorrect because dizygotic twins may implant close to each other, but they develop their own placentas because they came from different eggs. Number 5. Baby Sia is 2 months old and is usually placed on her stomach to sleep because her grandmother believes it helps with breathing and strengthening of the neck. What is most likely a health risk associated with this practice? A. Increased risk of sudden infant death syndrome or SIDS. B. Delayed development of head control due to reduced neck movement. C. Higher chance of sleep disruption due to startle reflex. Or D. Slower digestion caused by pressure on the abdomen. So the correct answer is A. Stomach sleeping increases the risk of SIDS, particularly in the first year of life. This is likely due to compromised breathing or overheating. For option B, it is incorrect because sleeping on stomach may limit movement but doesn't directly cause delayed neck development. Being in the prone position while awake actually helps with a baby's head control. Option C is also incorrect. The Moro reflex or startle reflex is more often triggered in the supine or back sleeping position. Option D is also incorrect because it is not supported by evidence, and pressure on the stomach may cause minor discomfort, but it isn't known to cause major digestion issues.